As Governor Wolf said in announcing the new Reach Out PA initiative, we must all do everything we can to help people struggling with mental health know that they will be heard and supported. These voices need to and deserve to be heard. Suicide can be extremely isolating for attempt survivors and loss survivors, and the bravery that these people showed in sharing their stories and experiences publicly will help all of us do more to prevent suicide and provide supports to people who need it most moving forward. Today, we are releasing a preliminary report that outlines themes and knowledge gained from these 10 listening sessions, recommendations to reduce suicide by firearms that were given to the Governor's Special Counsel on Gun Violence, and next steps for the task force. I believe these themes and recommendations give us a clear path forward for actionable ways to support and enhance suicide prevention efforts across the Commonwealth. Someone you know is struggling, but they don't have to struggle alone. I truly believe that by elevating this issue and utilizing this meaningful collective approach to prevention efforts, that we will save lives across Pennsylvania. This is something that doesn't require extensive education or training. All of us can be an ally or a resource for someone who is struggling.
There were also comments consistent with the state and national data that certain populations are at greater risk. Farmers were among the populations specifically called out at risk of suicide. The challenges farmers have experienced the past several years, ranging from prolonged severe weather to unexpected market changes to negative operating margins, all affect mental health and add layers of stress, the kind of stress that is often too difficult to discuss and is borne alone. As the report notes, we need to learn how to recognize the risk factors for suicide, be ready to intervene, and help connect at-risk individuals with resources.
In the military and in veterans, we've been talking about military suicide and veteran suicide for quite some time, and our numbers have been on a rise. There are a great number of people throughout the Commonwealth that are just uncomfortable discussing this topic. Okay, and we have to get over that. We have to be able to talk about these things openly, and anyone that's considering or anyone that's having a problem has to be able to be comfortable enough to freely talk to other people about it.
More than 10 agencies representing varying constituencies and subject matters. It was
identified the farming and the military communities as being susceptible. Did that come out of the hearings, or do you have data that says, that